culture, Al-Dqour,
Yeah.
and you will be talking about a totally different type of aspect from pharmaceutical industry point of view, but that is really great.
They make it hard on purpose. There are life between our hands. And there comes a moment when you either take that step forward or just turn around and walk away. Well, do I have a conflict of interest? I'm a pharmacist, but also I am a pharmaceutical representative. The story behind this presentation has developed earlier this year in the highway between Zarqa, one of the Jordan cities, and Amman, the capital city of Jordan. I was wondering, does it really matter? Those car accidents, sometimes life-threatening. So does it really matter what we are doing? What's wrong with healthcare? Most services are want services. People want to dine out, want to talk on their cell phones, even want to get a haircut. In 2008, Pharmaceutical Research and Manufacturers of America, they voluntarily updated their guidelines and stopped what's called non-educational gifting. In Jordan, it is stated by the law that pharmacists are the only person that should deal with medicine. So this presentation is aimed to establish the first insight of the Jordan market in terms of the pharmaceutical representative intentions toward the future that are encouraged by the pharmaceutical industry. Take a look to the four participants. We have almost 65% male versus 35 females. 55% of those respondents have the experience 1 to 3 years in the representative field. The first question, are we proud to be a pharmaceutical representative? Amazingly, 75% of the respondents said yes. We are pharmacists, but we are also proud to be part of the pharmaceutical industry. We are rising in the costs, quality issues, medicine accessibility issues, so they are forced to take new reforms in terms of access to the medicine, and we as a pharmacist should play a role in that. If we ask the Mona Lisa, do you feel valued by those lovers who are coming to Paris and take that photo shot with you? On behalf of Mona Lisa, I would say yes. We ask this to our medical representative. Do you feel value, and are you satisfied with the way that healthcare members, excluding pharmacists and doctors, another with physicians, with pharmacists? I was shocked with the result. We, as a pharmacist, are not valued by ourselves in terms of pharmacist to pharmacist interaction. Almost 30%, 32% of the respondents said we are being satisfied with the way that pharmacists interact with us. A good marriage is built upon, first, being optimistic about the future of this relationship. The second is the commitment to be in that future. We asked those to our respondent, saying, are you optimistic about the future of the pharmaceutical representative here in Jordan? I'm not worried about the result, like 20%, but I'm pretty confused about that 58% of the respondents who said we are in the neutral, we are in the gray area. So please, stand up and you are the drug expert. Be the leader that would shift the pharmacy profession toward best future. Back in home, we have like phrase, it's white heart. You are dealing with a good intention. If you are going to detail this to the patient, what do you think those patients said? They are thinking by how good the drug sales girl that sells it to him. That's how they decide. That's how doctors think. This is just a perspective of one of the patients documented in the literature. So that's the medical. In terms of investment, return of investment, do you know that with $1 we spent on educational materials, educational, continuous medical educational events, the pharmaceutical industry get $3.52 return of investment. Are we going to be materialistic? No, just... We asked them, do you feel that you've been like 5 years studying pharmacy, 6 years as PharmDs, you think that you still make a difference in patient life? Amazingly, 80% of the respondents said yes, we are making a difference. It is stated by law that only pharmacists should work or should deal with the medicine issues. This is what's going on the market. You know, in Egypt this year, one of the multinational company has stopped recruiting pharmacists to be a medical representative. They start to choose to recruit from science, from history background. The last question in the board was, why do you think physicians write certain brands